Hello, everyone. My name is Stacey Adelman, and I'm a registered psychologist and owner of Joshua Tree Learning Center here in Regina, Saskatchewan. And we try to go live every Tuesday at 12. And I apologize for missing last week, but I'm feeling better and back at it this week. So today's topic is 5 myths about learning disabilities. So this is something that I feel really needs to be talked about because I find in my work, both as a teacher and as a psychologist, I've come across a lot of misunderstandings about what exactly learning disabilities are. How can we identify a learning disability? And then what are things that, or strategies or interventions that we can do to help remediate or assist or accommodate individuals that do have learning disabilities? So I really wanted to talk about some of the common misunderstandings to help us better understand exactly what a learning disability is. And so I think the first myth is that learning disabilities tend to get clumped into a category similar to autism, ADHD, intellectual disability. They're kind of all, together. And what I really want to emphasize is that a learning disability is a category of its own, with its own specific diagnostic criteria. It's specifically due to deficits that are in information processing. You'll see it, learning disabilities tend to show up in reading, writing, and math, and not due to deficits in hearing or vision or an intellectual disability or another mental health disorder diagnosis of some kind or motor impairment. It's its own diagnosis. Learning disabilities can really affect people emotionally and socially. So it's really important that we're able to identify them and understand them and provide the correct support to assist them. So that was myth number one, that a learning disability does in fact have its own diagnosis and is not clumped in with other diagnoses such as ADHD and so on. Another myth about learning disabilities is that they're very easy to identify. That is not always the case. It can be quite tricky sometimes or very challenging to identify a learning disorder. You can't identify a learning disability through things like a blood test or genetic testing or a CAT scan. You won't identify it that way. LDs, we do know, can run in families. They're not there due to somebody being lazy or unmotivated. So in fact, to identify a learning disability, it takes quite a number of assessments, and it starts with parents and teachers collaborating and working really closely together and understanding when to get an educational psychologist involved in order to determine what that learning profile is and identify whether or not a learning disability is present. So there are key things that parents and teachers can be looking for in each of those areas, specifically reading, writing, and math. You'll see a lot of deficits, particularly in spelling, for example. And so there's processes at the school level in terms of interventions and the kind of extra supports and interventions that have been put in place and maybe haven't been effective or aren't working. We're just not seeing the outcomes that one might expect given the additional support. And so it can take some time, and it can be quite a frustrating process, for all parties involved. So really important that we continue to collaborate and work together and get a better understanding of what learning disabilities are. It's a common misunderstanding that kids with learning disabilities have a low IQ. That is not true. The diagnoses of a learning disability is often that kids have average to above average IQ, but for some reason, due to I call it kind of a neurological quirk in their profile, that they're achieving at a much lower level than what we would expect. And so it's our job as an educational psychologist to be able to figure out, okay, why is there that discrepancy, and how can we figure out um, why there's such a difficulty, in learning in each of those particular areas. So just to recap, um, individuals with learning disabilities actually have average to above average IQ and should not be um, confused with an intellectual disability or individuals that have a lower IQ. So there's a common myth as well that learning disabilities are becoming more common. Um, and it's actually the opposite. We find that learning disabilities are really underdiagnosed. I think particularly because it can be difficult or challenging sometimes to spot them, or sometimes if individuals are struggling in subject areas in school, we tend to think it may be because due to lack of motivation or lack of support, or that they're not trying their hardest or things like that. Um, so they actually go underreported, underdiagnosed. I think we're getting much better at it, and we're starting to catch them a lot sooner. And again, working with an educational psychologist and talking and collaborating with your teachers can really help us try to figure out, well, what are the reasons between, for the struggles that our students might be having in school. This could even be as an adult, sometimes maybe they got missed with a diagnosis in their school years or their high school years and are just not understanding why they might be struggling so much at the university level or post-secondary level. So it's really important to talk about it and get those symptoms acknowledged and checked out. And finally, it's a common myth that learning disabilities can be cured or that they can just go away with time or maturity. And we know that for sure to not be true. Learning disabilities do not just go away over time. We do know that they require specific remediation from an individual that has a strong understanding of the remedial process or the exact reason as to why the individual may in fact be struggling with a learning disability. So very, very important that an individual that's providing tutoring really have a solid understanding of what learning disabilities actually are in order to provide that remediation, as well as there's a lot of interventions, accommodations, and things like that that can happen that can support individuals that have learning disabilities. So individuals with learning disabilities, they struggle, but they can certainly go on to achieve success in many areas. I always like to use the example of the individuals on the show Shark Tank. I think most of those sharks on that show have diagnosed learning disabilities. Individuals with learning disabilities tend to be very adaptive, and they learn how to hide or to accommodate their difficulties, which is another reason they can actually be difficult to spot because they are so highly adaptive. And that's actually a strength I find with individuals with a diagnosed learning disability. So here at Joshua Tree, we have several individuals who are educational psychologists that are competent in the diagnosis of learning disabilities. I should state, as I mentioned earlier, it tends to be associated with autism or ADHD or mental illness. Those diagnoses can exist together. They can both be present, but one is not necessarily causing the other. They just tend to be present together. So that can certainly happen. But that's also the work of an educational psychologist. We can help figure out those intricacies and provide more detailed information in those particular areas. Again, I just think it's so critical that we understand truly what a learning disability is so that we can remediate at as early as possible and help individuals figure out how they learn. So again, I don't necessarily love the word disability because it implies that they can't learn. I think they actually can. We just have to teach the individuals how they learn so they can be able to use strategies and use their strengths and their learning profile to help them succeed and move forward, as well as provide intensive remediation to support some of those weaknesses in their learning profile. So if you have questions about learning disabilities, I'm more than happy to talk more about it and answer any questions you have. We have an amazing team of educational psychologists here at Joshua Tree that do provide psychoeducational assessment, but you can also just book an appointment with one of us, and we are happy to talk about, whether or not we feel a psychoed assessment is appropriate at this time, perhaps what some next steps might be. We also have a remedial tutor here at Joshua Tree Learning Center who was a learning resource teacher in the public school system for decades and is now an educational psychologist. And she provides the intensive remediation for individuals with learning disabilities, as well as other issues such as ADHD and intellectual disability. So our tutoring is provided by someone with a very strong understanding in the differences between those learning profiles and can create individual programming for students. So again, if you have any questions, please call us at any time. We are more than happy to help and to answer any questions that you have. Thank you so much for joining us today, and we'll see you next Tuesday at 12. Take care, everyone.